Gauteng health officials say the province is driving the third wave in the country. This comes as the province recorded more than 10,000 COVID-19 cases in the past 24-hour cycle. The chairperson of the Gauteng Premier's Advisory Committee, that is, Dr. Mary Kawonga, has described this week as a tough one.
This has been a tough week for Gauteng. We've seen the highest cases recorded since the pandemic started. We've seen the highest percentage test positivity since the pandemic started. So we're not in a very good situation in terms of COVID-19 pandemic. As the graph shows here, this graph really is showing the 7-day rolling average of daily new infections of COVID-19. The orange line is Gauteng and the blue line is South Africa. If you can look very carefully at the first and second wave, there was quite a big gap between the orange line and the blue line. So the gap between the orange line and the blue line was the other provinces in the country. The orange line represents what was happening in Gauteng. But as you can see, since the third wave started, the gap between the orange line and the blue line is very small. So this is really just bringing home the fact that Gauteng is driving the COVID-19 pandemic in South Africa in the third wave. So the contribution of all the other provinces to the current South African third wave is minimal. And this was borne by the fact that in the last few weeks we've been seeing between 60 and 62% of all new cases in South Africa have been reported in Gauteng province. On the 23rd of June, as I mentioned earlier, we had the highest recorded cases since we started the pandemic of over 10,000 cases in one day, and this was 62% of all cases in South Africa.
Meanwhile, Gauteng Premier David Makhura has raised great concern over the province's positivity rate. Makhura says 1 out of 3 people in the province is likely to be carrying COVID-19.
1 out of every 3 people in Gauteng are likely to be carrying the virus. So that 34% of positivity rate is a scary statistic. So if you are 3, 1 of you, so let's just see how we can slow down the infection, and it is in our capacity to do so. We did it. The rest of the things will be national decisions. We want to focus on what we can do in Gauteng province.
Well, let's get more on this from Professor Bruce Mellado, a member of the Gauteng Provincial Coronavirus Command Council. He's a mathematical modeler. He's the person who makes the predictions, who plots the graphs that we've seen. Professor Mellado, I know you've had a long day, sir. Thank you very much indeed for your time tonight on The Pulse. What we're seeing at the moment, the sharp number, the very large number of new cases in Gauteng, is this pretty much the worst-case scenario that you predicted?
Thanks for having me. Indeed. Yesterday we saw a serious spike in the number of cases, about 11,000. It's not just the record, but it's the magnitude that actually matters here. So we do a careful examination of the numbers, and so far, up until 2 days ago, all the numbers were actually lying along what we call the worst case scenario, meaning that if we keep going with the same level of adherence to social distancing as we have had before and continue to pass the virus to everyone else, then we're going to basically, have everybody had the virus at some point. That's what the worst case scenario is. And that worst case scenario did not realize during the first and the second. Now, what appears to be showing up in the numbers is a new or second spike. And this is a sign that our adherence to social distancing is degrading in the middle of the pandemic. And that's a very serious concern. And we are raising the alarm again because the spikes are extremely dangerous when it comes to numbers. It creates very large numbers and a lot of pressure on the healthcare system. As a result of that, should we have today and tomorrow similar numbers, we certainly should consider seriously tightening restrictions.
So, I mean, it's tempting for me as a human being to want to blame a new variant, or I want to blame this, or I want to blame that. What you're saying is that this is actually about the way I've been behaving. I live in Gauteng, and we have not been doing social distancing. We haven't been wearing our masks, and that's why we are where we are right now.
Absolutely. And the reality is staggering. It's not just the numbers themselves, but we do get reports about behavior on the ground. We get different reports from different quarters. We also look at social distancing. We look at the numbers very carefully to see how they evolve. And it's evident that the level of adherence that we have today has degraded significantly. And in fact, if you want me to give you a quantitative estimate as to where we are, the efficiency of non-pharmaceutical interventions now are about a factor of 2 less, a factor of 2 worse compared to the first wave. So that is the result of lack of adherence. So it is unfortunately a societal problem. It's unfortunately a problem of non-compliance. And if you look carefully at the numbers and how they are distributed, the numbers, the pandemic is absolutely everywhere. Every single sub-district in Gauteng is technically in a third wave. So that means that it's a massive societal issue in regard to a lack of adherence.
If we continue like this, I mean, how bad could it be? Is it possible to predict when the peak will actually be the peak?
So we still believe that the peak will happen around the 1st of July. We are in the middle of what appears to be, again, is not yet certain 100% of what appears to be somewhat of an uptick, somewhat of a spike. We are seeing, however, that the acceleration is dropping, so the rate of increase in the number of cases with respect to the previous week is dropping. We had the first spike about 2 weeks ago with an increase of 74%. That dropped to 58%. Now we are at 44%. It's clearly that we are slowing down. It's just that we really hope that the slowing down, the rate at which we slow down is fast, and it's not really fast enough. So unfortunately, the pressure on the healthcare system is tremendous.
When you talk about a peak at the 1st of July, so this would be the highest number of cases, of new cases being reported every 24-hour period. How long could that peak last? In other words, if we just take a number, say, just for argument's sake, 10,000 new cases a day in Gauteng, how long would that peak last? Do you expect it to go down as quickly as it went up?
That's a very good question. Now, we can appeal to modeling and also to past experience. So if you look at the numbers of the first and the second waves, you saw that it took about 5 to 7 weeks in order for the peak to basically go down to very small numbers, the numbers that we basically call a situation of equilibrium. Now, obviously, there is a big gap in between that peak and the small numbers, a few hundred cases a day that we have been experiencing in between peaks. So that's roughly the time that it takes. Modeling also agrees with that assessment because, you cannot stop a wave and all of a sudden numbers go to zero. I mean, there's a process of a slowing down that has to take in. There's dynamics that underlie the system that have to take in. Now, if you ask me the question, how long will it take for the number of active cases to, for instance, drop by a factor of 2, is typically 3 to 4 weeks. That's basically what it has taken so far, and modeling also agrees with that.
So what that means then, if I've understood the situation correctly, is that the peak, 1st of July, if your predictions are correct, and they have been so far, that would be the night at which we get the highest number of new cases, but the highest number of hospital admissions would probably come after that, maybe a week after that, because that's how long it takes to get severe symptoms of COVID-19. Would that be a correct prediction? That's about right. There's a delay. Of course, it's difficult to measure exactly what the exact delay is. It depends on many factors, but certainly there's a few days to a week that the difference of the peak would be certainly shifted by about that much. And unfortunately, mortality would also come delayed with respect to that. Professor Bruce Mellado, a member of the COVID-19 Gauteng, or the Gauteng Coronavirus Command Council. I do appreciate the time. A mathematical modeler, the person in charge of predictions for the province. Professor, thank you.